we have already completed the various muscles of the lower extremity with its different compartment. Now the next, here we will discuss about the various nerve in the lower extremity, and today the topic is the femoral nerve. And femoral nerve is the main nerve of the anterior compartment of the thigh, and I have already discussed when detailing about the anterior compartment, muscles of the anterior compartment. I already told that muscles of the anterior compartment is supplied by the femoral nerve. So femoral nerve is the main nerve of the anterior compartment of the thigh. So it is the main nerve of the anterior compartment of the thigh. And it is also called the chief nerve of the anterior compartment of the thigh. And here we will discuss about its origin, course, distribution and its various branches. First one, the origin. It's originated from the lumbar plexus. Here, these are the lumbar vertebra. I think this is the L1, L2, next L3, L4, 5. So from here, from the lumbar plexus, the femoral nerve is originated, and these are the ventral division. This side things, this is the ventral division. This is the ventral division. From ventral division of lumbar 2, 3, 4, from here the obturator nerve is originated. Obturator nerve. And think this is the dorsal division. Like this way. This is the femoral nerve. This is the dorsal division. So the femoral nerve is originated from the dorsal division of the anterior primary rami of the lumbar L2, L3 and L4. So it is originated from the dorsal division of anterior primary rami of L2, L3 and L4 nerves. And it is the largest branch of the lumbar plexus. So origin of the femoral nerve, it originated from the dorsal division of the anterior primary rami of lumbar 2, 3, 4 nerves of the lumbar plexus. Here, after the origin from the lumbar plexus, it lies behind the inguinal ligament. It lies behind the inguinal ligament, then descends to the femoral triangle. Here, the femoral nerve situated lateral to the femoral artery, which I have already told when discussed about the femoral triangle. Now below the inguinal ligament and 2 centimeter below the inguinal ligament, think this is the inguinal ligament, and here it is situated posterior or behind the inguinal ligament, and below the inguinal ligament 2 centimeter below the inguinal ligament, it divides into 2 divisions. One is posterior division, that is the posterior division, B for posterior, D for division, and another is anterior division. And this is divided by a artery which is called, think this one is artery. It divides the femoral artery into 2 divisions, that is posterior division and anterior division. And this is divided by this is called lateral circumflex femoral artery. The lateral circumflex femoral artery. And it is a branch of profunda femoris artery. It is a branch of profunda femoris artery. Profunda femoris artery. And profunda femoris artery is a branch of femoral artery. Branch of femoral artery. Next, so here it is divided below the inguinal ligament, 2 centimeter below the inguinal ligament, and it divides by the lateral circumflex femoral artery into two parts, that is 2 division, posterior division, anterior division. The lateral circumflex femoral artery is a branch of profunda femoris artery, and it is a branch of femoral artery. Next, branch. Here total 3 branches. One is muscular branch, which is also called motor branch. Next one is cutaneous branch. It is also called sensory branch. And next branch is articular branch. Now the first one, that is the muscular branch. The muscular branch Means here two division are found. First one is anterior division, next that is the posterior division. Here in case of anterior division they only supply the sartorius muscle. Sartorius muscle. That means nerve to the sartorius muscle. In case of posterior division, here it supply the mainly the quadriceps femoris group of muscle. That means rectus femoris. That means posterior division is innervated into the rectus femoris muscle. It is also called nerve to the rectus femoris. And next three vasti group of muscle. It is vastus lateralis, vastus intermedius, vastus intermedius and vastus medialis. So the posterior division supply this muscle. This is the quadriceps group of muscle. That means rectus femoris muscle, vastus lateralis muscle, vastus intermedius muscle, and vastus medialis muscle. I have already discussed about the anterior compartment of the muscles of the anterior compartment of the thigh. That, here in case of anterior compartment of the thigh muscle, mainly these four muscles are present along with sartorius muscle and articularis genu muscle. So articularis genu muscle is supplied a branch from nerve to the vastus intermedius. This is supply the articularis genu muscle. Articularis genu muscle. Articularis genu. So a branch from the vastus intermedius muscle, it supply the articularis genu muscle. Now the next branch, that is the cutaneous branch. Is the cutaneous branch. Here also the anterior division and posterior division. When the anterior division gives two cutaneous branches. One is intermediate cutaneous branch of the thigh. Next, medial cutaneous branch of the thigh. Medial cutaneous branch of the thigh. And the posterior division gives the cutaneous branch, that is the saphenous nerve. is the saphenous nerve. Next, it is the articular branch. Here the articular branch, the two joint, that is the hip joint and knee joint. These are supplied by the femoral nerve, the hip joint. First one, the hip joint, and especially the hip joint, it is supplied by the nerve to the rectus femoris. That means the division, that means the posterior division of the femoral nerve, which supply the rectus femoris muscle, that also supply the hip joint. That's why it is called the nerve to the rectus femoris muscle. Nerve to rectus femoris. Next, the knee joint. Especially the knee joint, it is supplied by the nerve to the vastus medialis. That means the division of the nerve which supply the vastus medialis muscle, it also supply the knee joint. That means nerve to vastus medialis. Now we can try to understand with the picture. It means this is the femoral nerve. This is the femoral nerve, and femoral nerve which comes from dorsal division of the lumbar plexus, or from L2, 3 and 4. This is the from here the femoral nerve is originated. Then from originated or after originated from the lumbar plexus, it runs downwards like this way, and here the gluteus maximus muscle is situated, and within this gluteus maximus muscle the femoral nerve is moves downward, and here this is the inguinal ligament. This is the inguinal ligament. Here it lies behind the inguinal ligament, and 2 centimeter below the inguinal ligament it gives 2 branches, that is 2 division, that is one is anterior division, another is posterior division. And the posterior division, which are supply mainly the muscles of the quadriceps group of muscle. That means these are the vastus rectus femoris muscle, this muscle, and this is supplied by the femoral nerve, posterior division of the femoral nerve. Next, vastus intermedius muscle, below the rectus femoris muscle, vastus intermedius muscle is found or situated, and it also supplied from the posterior division of the femoral nerve. Next, that is the vastus lateralis muscle. That means this is the yellow color showing the posterior division of the femoral nerve. This also supplied the vastus lateralis muscle. Next, the vastus medialis muscle. This is the vastus medialis muscle, and this is supplied by the posterior division of the femoral nerve. Next to the sartorius muscle. That means, and this one is sartorius muscle, and sartorius muscle is supplied by the anterior division of the obturator nerve, and there the cutinous branch, this one the cutinous branch, the saphenous nerve, this is the cutinous branch of the posterior division of the femoral nerve. This is the better understanding. Look at the picture. See, this one lumbar vertebra 2, 3 and 4. From here the femoral nerve is originated, and then it supply the iliacus and pectineus muscle, or also called in the femoral triangle. We have already told the femoral triangle, which the floor is formed by the iliacus, psoas major, pectineus, and also the adductor magnus muscle. So from the in the femoral triangle, it the femoral nerve is situated a groove between the iliacus and pectineus muscle, and also it supplies the branch or innervated between these two muscles, iliacus and pectineus muscle. So above the inguinal ligament, that is the inguinal ligament, above the inguinal ligament, it gives two branches for the iliacus, nerve to the iliacus and nerve to the pectineus muscle. And here, and this is the inguinal ligament. Below the inguinal ligament, it is below the inguinal ligament, it runs downwards, and here it is separated from the femoral sheath, and here the femoral artery also situated in the medial side of the femoral nerve. That means the femoral nerve is situated lateral to the femoral artery, and below the 2 centimeter here, the two division is it is divided by two division. This one is anterior division, another is posterior division, and anterior division gives two cutinous branch, which I have already told. That is, one is medial cutinous nerve of the thigh, it is medial side, and another is intermediate cutinous nerve of the thigh. And this one, this is also the cutinous branch, and it is the cutinous branch of the posterior division of the femoral nerve, and it continue as a saphenous nerve. Then these are the muscular branches, which supply the rectus femoris muscle. This is rectus femoris. It is also called nerve to rectus femoris, and from here also gives a articular branch. That means this one, the articular branch for the hip joint, and it is also called the nerve to the rectus femoris. Now next, the posterior branch division of the femoral nerve supply the vastus lateralis muscle, then vastus medialis muscle, then vastus intermedius muscle. And vastus intermedius muscle, from here nerve to a branch from the vastus intermedius, it supply the articularis genu muscle, and these are the muscular branch, or also called the motor branch of the femoral nerve. Next, this one is anterior division. This is the anterior division. This one, this is anterior division. Anterior division also gives a muscular branch for the sartorius muscle. Here see the picture, and that means here below the inguinal ligament, there are two division. Divide the femoral nerve divide into two division, anterior division and posterior division, which I have already told that it is divided by a lateral circumflex femoral artery. That means the red color showing, this is the this is the artery of lateral circumflex femoral artery. See, this another picture for better understanding. And the yellow color, this is showing the femoral artery. And it originated from the lumbar plexus, the dorsal division of the anterior rami of the lumbar 2, 3 and 4. And now this is situated between the gluteus maximus muscle. This is the area for the gluteus maximus muscle. Then it runs downwards and situated behind the posterior of the inguinal ligament. This one, the inguinal ligament. It is situated below the inguinal ligament. Then 2 centimeter below the inguinal ligament, it divides into anterior division and posterior division. This orange color showing the this is the anterior division, and the yellow color, this is the posterior division. Here the anterior division gives one muscular branch for the nerve to the sartorius muscle. This one, nerve to the sartorius muscle. Then there are 2 cutaneous branch. This one, this is the cutaneous branch, which is called intermediate cutaneous nerve of the thigh. This supplies the skin of the middle of the anterior part of the thigh. Then another cutaneous branch, this one called the medial cutaneous nerve of the thigh. That means this also supply the skin of the anterior compartment of the medial side of the thigh. And next, the yellow color, this one, and this is the this is the saphenous nerve. It is the cutaneous branch of the posterior division of the femoral nerve. And next, these are the this yellow color, these are the posterior division of the femoral nerve, and these are the muscular branch or motor branch which supply the, that means this muscle is called, this is the lateral side, this is called vastus lateralis muscle, this one, and this is supplied by the nerve, posterior division of the femoral nerve. Next, rectus femoris muscle, this one. Here the yellow color, this is for the nerve to the vastus, nerve to the rectus femoris. That means it also comes from the posterior division of the femoral nerve. Next, vastus medialis muscle. It is situated medial to the rectus femoris muscle. This one. This is the this muscle is called vastus medialis muscle. Here, this one. This is the nerve of the posterior division of the femoral nerve, and this is nerve to the vastus medialis muscle. That means it the femoral nerve, the posterior division of the femoral nerve, innervated into the vastus medialis muscle. This one, and below the rectus femoris muscle, the vastus intermedius muscle is situated. It also supplied by the posterior division of the femoral nerve. আমি নেক্সট আবার রিপিট করছি again I repeat from the beginning. That means the femoral nerve, it is the nerve of the anterior compartment of the thigh, and it is the largest nerve of the anterior compartment of the thigh, or it is the largest branch of the lumbar plexus. Now, origin of the femoral nerve, it originated from the dorsal division of the anterior primary rami of the lumbar 2, lumbar 2nd, 3rd and 4th nerves of the lumbar plexus. Now, course of the femoral nerve. Now, course of the femoral nerve. The femoral nerve is the largest branch, and the nerve descends from the lumbar plexus. The nerve descends from the lumbar plexus and traveling through the psoas major muscle. Traveling through the psoas major muscle, then runs downwards behind the inguinal ligament, and then below the 2 centimeter of the inguinal ligament, it divides into 2 division. One is posterior division, another is anterior division, and it is divided by artery which is called lateral circumflex femoral artery, and it is a branch of profunda femoris artery, and it is a direct branch of the femoral artery. And here in the femoral triangle, it is situated lateral to the femoral artery. Here, like this way, in the femoral triangle, like this way, the femoral artery is situated. So the in the femoral triangle, the femoral nerve situated lateral to the femoral artery. And it lies also outside to the femoral sheath and gives the articular branch for the hip joint and the knee joint. And it says the branches of the femoral nerve. One is muscular branch, and it is also called the motor branch. Another is cutaneous branch, also called the sensory branch. Next, the articular branch. Now, the muscular branch, the anterior division gives the supply or anterior division innervated into the sartorius muscle. Next, the posterior division, it supplies the rectus femoris muscle, then vastus lateralis muscle, vastus intermedius muscle, and vastus medialis muscle. And a branch from the vastus intermedius muscle, it supplies the articularis genu muscle. Next, the cutaneous branch. The anterior division of the femoral nerve gives 2 cutaneous branches. One is intermediate cutaneous branch of the thigh. Next is medial cutaneous branch of the thigh. And the intermediate cutaneous branch of the thigh and medial cutaneous branch of the thigh, they supply the skin on the anteromedial side of the thigh. Anteromedial side of the thigh. And the posterior division, posterior division gives a cutaneous branch for the saphenous nerve. And the saphenous nerve, it also supply the skin on the medial side of the foot of the leg. It supply the medial side of the foot and leg, and these are supply the anteromedial side of the thigh. Anteromedial side of the thigh. Means skin of the anteromedial side of the thigh, and here it supply the skin on the medial side of the foot and leg. Next is articular branch. First, there are 2 articular branches. One is for hip joint, another is for knee joint. And the hip joint, it is supplied by the nerve to the rectus femoris muscle. And the knee joint, it is supplied by nerve to the vastus medialis muscle. And these are the rectus femoris muscle. It here the nerve to the rectus femoris, that means the posterior division of the nerve, it supply the rectus femoris muscle and also the hip joint. These are called the Hilton's law. Hilton's law. That means they supply the muscle and joint, muscle plus joint, and underline the skin. Underline skin. That means here the nerve to the rectus femoris, it supply the rectus femoris muscle and hip joint. This is called Hilton's law. And also the vastus medialis muscle, nerve to vastus medialis muscle, this supply the vastus medialis muscle, that muscle and the joint, knee joint, and these are called the Hilton's law.